Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about chronic kidney disease. Chronic kidney disease is a broad term that includes subtle decreases in kidney functions that develop over a minimum of 3 months. In contrast, acute kidney injury refers to a decrease in kidney functions that happens in less than 3 months. Now, the kidney's job is to regulate what's in the blood. So they might remove waste, make sure electrolyte levels are steady, or regulate the overall amount of water. And they even make hormones. The bottom line is the kidneys do a ton of stuff. Blood gets into the kidneys through the renal artery, and once inside, it goes into the clumps of arterioles called glomeruli, where it's initially filtered, and the filtrate, which is the stuff that gets filtered out, moves into the renal tubules. The rate of which the filtration process takes place is known as the glomerular filtration rate, or the GFR. The value is slightly less in women than men. Then it decreases slowly in all of us as we grow older. One of the most common causes of chronic kidney disease is hypertension. In hypertension, the walls of arteries supplying the kidneys start to thicken in order to withstand the pressure. And the results in a narrow lumen, and a narrow lumen means less blood and oxygen gets delivered to the kidneys, which leads to the ischemic injury to the nephrons and glomerulus. Immune cells like macrophages and fat-laden macrophages, called foam cells, slip into the damaged glomerulus and start secreting growth factors like transforming growth factor beta 1 or TGF beta 1. These growth factors cause the mesangial cells to regress back to their more immature stem cells state known as the mesangioblast. And then those mesangioblasts secrete extracellular structure matrix. The successive extracellular matrix leads to the glomerulus sclerosis, which is hardening in the scarring, which diminishes the nephron's ability to filter the blood. And over time, this leads to chronic kidney disease. The most common cause of chronic kidney disease is diabetes. In the situations, excess glucose in the blood starts sticking into the protein, a process called non-enzymatic glycation because the enzymes are involved. The process of glycations particularly affect the efferent arterioles and cause it to get stiff and more narrow. A process called hyaline atherosclerosis. This creates an obstructions that make it difficult for blood to lead to the glomerulus. An increase in pressure within the glomerulus, which leads to hyperfiltrations, essentially pushing more fluid through. In response to this high pressure state, the support of mesangial cells secrete more and more structural matrix, which expands the size of the glomerulus. Over many years, this process of glomerulosclerosis once again diminishes the nephron's ability to filter the blood and can lead to chronic kidney disease. Although diabetes and hypertension are responsible for the vast majority of chronic kidney disease cases, there are other causes as well, as including the systemic diseases like lupus and rheumatoid arthritis, which can also cause glomerulosclerosis. Other causes, though, includes infections like HIV, as well as long-term use of medications like NSAIDs and toxins like the ones in tobacco. Now, normally, urea in the blood gets excreted in the urine. When there's a decreased glomerular filtration rate, less urea gets filtered out, and therefore it has nowhere else to go besides the blood. And so, it builds up in the blood, which is a condition called azotemia. Azotemia can cause general symptoms like nausea and loss of appetite. But as urea levels really build up, that can affect the functioning of the central nervous system. Causing encephalopathy, this results in hysterexis, tremor of the hand that kind of resembles a bird flapping its wings, and it's best seen when a person attempts to extend their wrist. Further accumulation can even progress to a coma and death. This buildup can also cause pericarditis, which is an inflammation of the lining of the heart. In addition, there can also be increased tendency of the bleeding, since excess urea in the blood makes platelets less likely to stick to each other, and so there's less clot formation. Finally, in some cases, some can develop uremic frost, where urea crystals can deposit in the skin and they look like powdery snowflakes. In addition to getting rid of the waste, the kidneys play an important role in the electrolyte balance. Potassium levels are particularly important, and normally the kidneys help with the potassium excretion. In chronic kidney disease, though, just like with the urea, less potassium is excreted, and so more builds up in the blood. And this leads to hyperkalemia, which can be problematic because it can cause cardiac arrhythmias. Another key role of the kidneys relates to the balancing of the calcium levels. Normally, the kidneys help to activate the vitamin D, which then helps to increase the absorptions of the calciums from the diet. With chronic kidney disease, through their less activated vitamin D. So less calcium is absorbed into the blood, which results into hypocalcemia. Low calcium levels, as the calcium levels in the blood falls, the parathyroid hormones is released, which causes the bones to lose calciums. Over time, the reabsorptions of the calciums from the bones leave them weak and brittle, a condition known as the renal osteodystrophy. The kidney also releases key hormones. For example, normally when the kidney starts sensing a lower than the normal amount of fluid getting filtered, they respond by releasing the hormone renin to increase the blood pressure. In chronic kidney disease, the falling of the glomerular filtration rate leads to more and more renin secretions, which leads to hypertension. Now, remember that hypertension is the cause of chronic kidney disease itself. So this creates quite the vicious cycle. Finally, the kidneys also secrete the hormones erythropoietin, which stimulates the productions of the red blood cells from the bone marrow. In chronic kidney disease, erythropoietin levels fall, and this leads to the lower productions of the red blood cells and ultimately anemia. The diagnosis of chronic kidney disease comes down to looking at the changes in the glomerular filtration rate over time. Chronic kidney disease might be suspected with a GFR of less than 90 milliliters per minute or 1.73 meters squared. Irreversible kidney damage might happen with a GFR followed by 60 millimeters per minute for 1.73 meters squared. To confirm the diagnosis, a kidney biopsy can be done to look for changes like glomerulosclerosis. Treatment for chronic kidney disease often involve managing the underlying cause. In severe situations, dialysis or kidney transplant might be needed. Alright, as a quick recap, chronic kidney disease is when the glomerular filtration rate falls below 90 milliliters per minute or 1.73 meters squared over at least 3 months. Chronic kidney disease is mainly caused by diabetes and hypertension, and complications include electrolyte abnormalities, toxin buildups, hypertension, and weak bones.